Hello, everyone. Welcome back to the Social Work 12 podcast. I'm here with my co host, Faith, and today we're chatting about insurance versus private pay for your private practice. I feel like that is just a really kind of big decision that that social workers have to make. Like, am I going to take insurance? Am I not?
Mhm.
How does all this work also? So, yeah, we're going to get into the details. So excited for Faith to be here for this one because obviously she has real world experience with her private practice.
Yeah, dude, this is gonna be good. It's something that we don't always talk about, so I'm excited that we're gonna talk about it today. And it can be a bit controversial in the field, so it's nice to kind of
Mhm.
give space to it and talk about the different opinions as much as I don't know, as much as I know about them or as much as we can pull up. So,
Right.
yeah.
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 So I guess let's just start with like when you were starting your private practice. I mean, you were working
Yeah.
at a group practice, but like, what was your first thought about, gut reaction, insurance versus
Mhm.
private pay? Like, how were you thinking about it?
Mhm. Yeah, so when I first started private work, I was abroad, right? So I was in Switzerland, and it was a no-brainer that I would do private pay because I couldn't do insurance
Right.
because I lived abroad. So I wasn't able to do like their insurance. Yeah, I wouldn't have the credentials to do that there. So when I got back to the United States, I was like, sweet, now I can do insurance. Like, I'm legitimate. I can do
Mhm.
this. This is going to be great. And I think it made me feel initially really secure. Like, okay, I'm going to have a good, um, I guess, like referral source. My caseload probably will fill up pretty quickly. And I'm not going to have to like worry as much about can my clients afford this? It just was like a steady stream. So I was actually looking forward to it and saw it as a relief and like job security kind of, I
Hmm.
think.
Mhm.
Um in the beginning for sure. Yeah. I think I was like, this is great. Now I can actually provide affordable care and have a good decent income. Hmm.
Mhm. When you were,
Yeah.
when you came back from being abroad, you were at the group practice. Did you guys take insurance there?
Yeah, so they did take insurance there, but I didn't see all of that, right? Obviously, because you're in a group
Yeah.
practice, so there was like a split happening there. But yeah, that we took insurance there. I think everybody took insurance, and I think there were moments where some people were trying to do all private pay, and everybody would talk about like they're not full, they can't fill their caseload, like it's really hard to fill your caseload, and
Mhm.
so there was a little bit of this feeling of intimidation to for me at least, or like, ooh, you're gonna have to just give it time and space for your caseload to fill up if you want to go private pay. And so you have to have like the financial flexibility to do that, right? I would
Mm.
think.
You mean when you're transitioning from a previous employer? Is that what you mean? Like,
Yeah, I mean,
to
if you're
then
transitioning,
Mhm.
yeah, if you're transitioning from employers and you want to go all private pay and the employer is okay with that, then like if you're in a group practice and you say, I would like to do private pay, like your employer also would have to be okay with that. Cause if they're taking a split, they want also consistent income probably
Mhm.
as well. So, yeah, you probably have to have the financial, I guess, stability or safety net for yourself to go without pay for a little while you're building up your private pay practice. And
Mhm.
sometimes that could take like 6 months. I've heard from some people, but that's not always the case. But I think that there's just like that fear of like, ugh, can I, yeah, like, would I be able to afford my life while also trying to fill my caseload and all of that with private pay. At least that's what I was feeling for
Yeah.
sure. Mhm.
Yeah. That also makes
Yeah.
me think about just kind of the reading that I've done for well, I was gonna maybe start a private practice, and then I was
Okay.
like, "Actually, I don't wanna do this."
No.
Um, did
Yeah.
you know that?
You
Did
did
I
tell
tell you
me
that?
that. Yeah,
Oh,
you
yeah, yeah,
did tell
yeah.
me that. Yeah. Yeah.
Um, but one thing
Why
that
did you decide not to?
I gosh, I was in a transition from my current job. Not in transition,
Mm.
but just starting to feel like, I don't know, is this sustainable? We were gonna be moving, and I couldn't do the job that I do now
Mhm.
remotely.
Yeah.
So I mean, fast forward to now, I'm just like a travel social worker, but part of me was thinking maybe I could do remote work,
Yeah,
and just have like a complete virtual,
that's cool.
practice. And um, I remember reading about, going private pay. It really could benefit you to really niche down.
Mm,
Um,
mhm.
and obviously, there's still going to be time. It's still going to take you time to grow your caseload, but it seemed like if you were going to be private pay, like really niching down and getting specific about the population that you want to work with is
Yeah.
important.
Mhm.
Um, and then so I was considering kind of honing in on grief and loss and supporting
Oh,
people
yeah.
through that, but ultimately I was just like, this I don't really want to do this. I don't actually want to
Mm.
start another business because I already have this business. Like, social work to wealth is
Yeah.
my side thing, and I wasn't gonna have the private practice on top of, like, working doing.
And then also your day job, and then
Yeah, and, like,
you're going to school.
I was
Taylor
gonna
does
leave
way
it.
too much.
It is true, but yeah, I was just like,
Yeah,
I feel like I'm forcing it, and
yeah,
if I'm gonna it would just be a whole new business kind of that I would need to learn, and I was just like, I don't really wanna
yeah,
do that, and wanna save
yeah.
energy for social work to wealth, and
Makes
also
sense.
pursuing, yeah, personal finance. So,
Mhm.
um, yeah,
That makes sense.
I think
Mhm.
it's important to kind of consider season of life, the capacity that you have, and also, yeah, the
Mhm.
financial like savings.
Yeah.
Um, what have you heard in terms of like niching down? Because I think some people are
Mhm.
concerned about like, well, I'm not going to get clients, or just
Mhm.
I feel like people think casting a wider net will help them bring in more people.
Mhm. Yeah, so I don't think that that actually is effective. I think
Yeah.
niching down is the way that you can run a successful private practice, because then you become known in the community as the person that does that specific thing as opposed
Yes.
to everything. And so then people are willing to maybe pay privately for that because you're specialized. Where if you just treat everything, well, why wouldn't I just go then to somebody else who takes my insurance and treats everything? Like
Yeah,
it
that's a good
there's no
point.
real incentive. And also when you niche down, you do like you become more specialized. You become really good at what you do and
Mhm.
you become known for that and your clients feel that. Not to say that people who take insurance aren't really good, they are. It's just you're getting more and more specialized. You're treating the same type of condition potentially in more than half of your caseload. And so you're just going to get more familiar with that or understand that more, do more trainings in it. And really, you're really marketable, I think, when you niche
Uh-huh.
down. People know what you do. And so then
Yeah,
when they're like, oh, I have this client who has
exactly.
this type of condition, your name comes to mind.
Yeah,
Mhm.
totally. Or when you're
Mhm.
going to network with people, like, "Oh, yeah,
Yeah.
this is what I'm specialized in," or if you're going to
Mhm.
doctor's offices or just networking with other
Mhm.
therapists, I
Mhm.
think it's helpful for
Yeah.
people to, yeah, have like, "Oh, when I think of Faith, Faith is OCD and
Mhm.
PTSD." Like, if I have a client, like,
Yeah.
I would
Yeah.
refer them to her.
Right. And also just like pediatric OCD, like even specializing down to the
Mm.
population, not just the condition, and then also the modality, like pediatric OCD, and I do ERP, right? So, like, really getting specific about what you do, um, I think is really, really helpful. I think the other thing is, I would recommend when you are, if you want to do a private pay, I'm speaking I don't do private pay, so I'm, like, talking like I'm doing private pay right now. I don't, and we could talk about
I
why
mean,
that
you're
is
doing both.
maybe in a minute.
You're
I'm doing
doing
both. I'm
it's
doing both.
hybrid, yes.
It's hybrid. It's a hybrid model, but, so we'll talk about that a little later. But I think one other little piece of advice is to not network with people who do what you do. So, like,
Mhm.
I wouldn't necessarily network with other OCD therapists only if I was like, "Hey, I need, like, more referral, like, I need to know, like, if my caseload's full, like, who I could refer an OCD client to, then obviously I would, network for that reason. But if you're looking for like referral streams, you want to network with people who don't do what you do,
Yeah.
who are going to run into that condition and be like, I don't know how to, I don't know what I'm doing here. And then,
Mhm.
refer out. So I think sometimes we can be like, oh, you do what I do, let's network. And it's like, actually network with people who don't do what you do.
Yeah.
Yeah,
Yeah,
maybe that's
that's a
a
good
simple
point.
piece of advice, but
Yeah.
yeah.
Yeah. Totally.
hmm Yeah.
Yeah, let's talk about private pay versus insurance pros, cons.
Yeah.
So I have here private pay pros, more control of your rates, less paperwork,
Mm,
client privacy because there's no diagnosis required, the insurance is not
mm,
looking at their notes. Um, Potentially fewer clients depending
mm-hmm.
on insurance reimbursements versus what you're charging, which could allow
Yeah.
you to have more energy and just like, yeah, maybe work less
Yeah.
days.
Yeah.
Cons for private pay requires more marketing, niche clarity, like we
Mm-hmm.
talked about. Can it feel emotionally harder to say your rate out loud? Like, I charge 155, you know? um,
Yeah, right.
any of those hit home for you from your experience?
Yeah, definitely. I think also another con would be it's gonna take longer to fill your caseload potentially, and there's 2 reasons for that, like, it's gonna be harder to find people who have the financial flexibility to pay privately, that's just gonna take time, and then
Uh-huh.
also, you might not have people seeing you weekly, you might have people seeing you every other week, and so if I'm trying to fill 20 slots with weekly clients, then I only need 20 clients, but if I'm doing private pay, I'm probably gonna have 40 clients on my caseload because you're gonna do every other week with people for financial burden,
Uh-huh.
that private pay causes. So that's also why it takes longer, is you just have to have, you're probably going to rotate people every other week as opposed to weekly. So that's just something to keep in mind. That's another con. But if you have the flexibility, you have the support system, you feel like you can do it, then in the long term, um, it's nice because
Yeah.
you don't have to worry about all the paperwork. You don't have to worry about
Insurance clawbacks.
insurance clawbacks. And you can have a little bit of flexibility in terms of how many clients you see, especially if your rate is a little bit higher. And yeah, so also sometimes this is not always true. And again, like throwing out a ton of disclaimers here, but like, don't come at me, people. Like, I'm trying, but but also sometimes people are more committed to the process because they're investing their
Their money.
money in a different
Mhm.
way, and so they're more
Mhm.
invested in the therapy process, and you sometimes can get better outcomes. So there's that as well that sometimes can happen
Mhm.
too.
Yeah.
So in my experience, private pay was super easy abroad just because of the environment I was in. It was super normalized. Everybody did it. It was expected. Here, I've felt more feelings about doing private pay and more intimidation to do private pay, just because it's not as normalized. And it is seen as something like, I think, more rare in like not everybody's doing it as much. And there's more like kind of opinions about it or,
Mhm.
that kind of stuff. Like,
Yeah. Let's talk about the
yeah,
opinions about that.
yeah, yeah.
Yeah, I was like, we were gonna talk about this later, but I feel like it's a good time because one of
Yeah.
the cons, yeah, I have down is feeling like you're not quote unquote accessible.
Mhm,
Kind of like
mhm.
the shame narrative. But
Yeah.
yeah, it was perfect timing for this episode. Yesterday, I saw this reel where the social worker was saying that she saw another reel,
Mm.
Inception, that a social worker was the social worker was saying, "You are not an anti-oppressive therapist if you're only private pay. Like, if you don't take insurance."
Mm.
Um, and that is just
Wait, say that one more time.
she said, "You're not." This video I was watching, she was talking about another reel, But that
Right.
social worker was saying, "You're not an anti-oppressive therapist if you don't take insurance."
You're not
Or
an anti-oppressive therapist if you
don't take insurance. Like,
don't
if
take
you're only
insurance.
private pay, you're not an
Mhm.
anti-oppressive therapist. And this person who I was watching last night was saying, like, first, this energy is kind of, like, misdirected. Like, the real
Yeah.
problem is the healthcare industry and, like, this
I was gonna
capitalistic
say
society
mhm,
that we live in,
which is oppressive.
which is oppressive. Yeah. So we're also in
Uh-huh.
this oppressive system
System.
trying to do what we can. One, why are we shaming other social workers trying to just, like, do the best that they can? That we're not here for that.
I don't
We're not here for
understand
that.
that.
And
Mm-mm.
then she was saying there's other ways to be an anti-oppressive therapist. Decolonizing your practice, protecting your client's identity, the way that you write notes, making your services accessible. Like, one way
Mhm.
to be more quote unquote accessible without insurance is to maybe have a sliding scale fee.
Mhm.
Like, there are other
Mhm.
ways
Yeah.
that you can kind of support your
Your
community.
clients. Yeah.
Um, and one other thing, I'm gonna bring up the video. Um,
Okay.
someone has said, like, "I submitted my credentialing to Medicaid 2 years ago, they still haven't paneled me. Of course, I've advocated for myself with the states. It takes a long time." Like, this these comments also don't take into account how challenging it could be to even get on a freaking
Mhm.
insurance panel, let
Mhm.
alone a federal insurance.
Yeah.
Like, what? What are we doing?
Yeah, and I think yeah, let's talk about insurance too. Like, I think that there's a lot of cons to doing insurance. Therapists have to do like this gymnastics to like not share too much information in notes, but share enough where you don't get clawbacks.
Uh-huh.
And no one really talks about or knows how to do that perfectly. And so you're always kind of sitting with this horrible feeling of
Stress?
anxiety of like, when am I going to get audited? When am I going to get my notes pulled? When am I going to get,
Yes.
is this going to piss off my client because I had to put something in the note in order for them to get insurance reimbursement that I didn't really want to have to put in the note, but if I don't, then they're not going to get it.
Right.
And like, it feels really, really scary at times because we're not our reimbursement rates aren't like amazing either, and so you're not like rolling in it to be able to cover like a clawback. And if for those of you who don't know what a clawback is, that's where insurance contacts you maybe a year or two even after you've met with that client and says, hey, we don't think that the services you provided on this date were actually necessary, and so we want the money back that we paid you. So if you don't have that money saved to give back to insurance or have a way of kind of contesting that or kind of fighting that,
Yeah.
um, you're kind of out of luck. And most therapists don't feel comfortable going to their client and saying, hey, 2 years after the fact, you have to pay me because your insurance actually didn't cover that one session or 5 sessions or whatever. Um, most therapists are just going to eat that cost and
Yeah.
give it to the insurance. And
Right.
so, like, if we want to talk about an oppressive system,
Yeah.
what is
Yeah.
that?
Yeah.
What
Yeah.
is
A health
that? And
insurance
so
company determining what's appropriate care when we are
mhm.
also, like,
Yeah, and some of these
massive
health
level clinicians.
systems yeah, right. And some of these from the limited knowledge I have, some of these, health insurance systems are now being run by, like, AI, like, some of these auditing systems, like, it's kind of, like, automatically run through to find, like, red flags, and so it's not even necessarily, like, I mean, I don't think it's like somebody going through and auditing every single claim. It's like they have an AI system that does
Yeah.
it, and then you kinda get this automatic audit email, so you should always contest it. You should never just, like, give the money. You should always contest it, but, I think that is a really intimidating process for therapists, and that's another reason why therapists don't wanna take insurance because it's
Uh-huh.
a lot of extra work, and then also the confidentiality for your client becomes tricky at times, with insurance. So,
Uh-huh.
yeah, in terms of, like, they can read progress notes and everything. Um, and they're not supposed to use that against uh, clients. Like they're not supposed to use that against clients.
Like,
Uh,
what's in the
s-
notes?
yeah, like to deny care or anything like
Mm.
that. Like there's been laws passed against that, but I think there's still always this feeling like that could happen. And I'm
Mhm.
sure there's cases where that still happens. Um, so yeah.
Yeah.
Mm-hmm.
Yeah, and we saw that we saw this article, what's her name? Charla Yearwood.
Mm-hmm.
She wrote an article, "Private Pay Therapy and Social Justice Can Coexist." I'll put it in the show notes. Yeah, and I just love she said, with the insurance, like, your business becomes dependent on companies that have little regard for you as a clinician, your clients, and the care that they're providing. And kind of the beginning context of the article was she used to think that if you know, didn't take insurance, then you weren't, down, and you weren't the social worker that wasn't like in it for social change. But over time, she's learned that like she can charge a rate that allows her to maintain like a sustainable caseload, and she's not forced to overload her schedule. She has
Mm-hmm. Mm-hmm.
time for professional development. And so it's
Yeah.
interesting.
I think like this idea that somehow you're not a social worker because you don't take insurance. Come on. That is just so unnecessary.
It's the martyr again and again, because we, for some reason, just have to, like, be the saviors and, like,
Be the
make it
saviors.
so easy for everyone to
Mhm,
have access to everything, and we try our best. That's why we, like,
mhm,
got into this work and went to school,
mhm.
but
It's
my
so
gosh.
it's so shaming, and it's actually not asking the right question or investigating the right question. Not it's just judging people for these decisions instead of saying, "Well, why is it that therapists are leaving insurance panels?
Yeah.
How about we get curious about that?" Oh, and there's like going to be because I think in some statistics I've seen, like 30% of therapists don't take insurance. That's a large amount of
Wow.
therapists that don't take insurance. Why is that? It's not because they're
Mhm.
all like, I don't care about people and I want to reduce access to mental health care and I'm just trying to get
Totally.
mine. Like, that's not what's happening. And
Right.
so these are people who care about their clients, who are trying to do good work, but they're sick of probably sitting with that anxiety all the time and they're
Mhm.
over it, or they had an experience where they're audited and they're like, I'm done.
Yeah.
Or and they're choosing not to engage in a system that they see as broken. Hmm.
Mhm. Yeah.
Hmm.
Let's see. So moving on to kind of like specifically
Yeah.
insurance, those are some cons, obviously.
Yeah.
Some reimbursement rates are low.
Mhm.
Risk of delayed payments,
Yep. Yep. And
um,
you could be waiting 3 months to get a claim
paid
paid.
out. Like,
Hmm.
you that's something you have to build into your, like, financial picture.
Yeah.
If you know, "Okay, I'm submitting this claim today, and I'm not gonna see the money until December or January," that is
Hmm.
that's really challenging, versus someone just paying with their card and you getting the money right away. So, definitely, I feel
Yeah.
like there's need to be a little bit, I guess I'm curious how you do that. Is that the payments that you
Yeah.
get, what are they through? Alma?
So I do Alma.
Yeah,
So for anyone who's interested in that, there's like I think Taylor on your website you have like
a
a
referral code.
yeah, a referral code, but also like a whole private practice blog post that you did.
Mhm.
And in there's a referral code and some other suggestions and stuff. But I do Alma, and the reason why I like Alma is because um they essentially guarantee that you're going to be paid within 2 weeks of the claim being submitted. So they kind of wait for the claim
Claim.
to be fulfilled by the insurance company and they pay you immediately, the therapist. And that was what attracted me to that because I was like, I don't want to wait 3 months for a claim. And then it's like, wait, what? Like, that just gets really messy. Like, how do you keep
Mhm.
track of all these claims coming in? And so I really liked Alma for the way that they tracked the claims, they paid it out right away to me, and I could just made things a lot simpler. And then also like they credential you with insurance and they're the ones negotiating the rate too. So so yeah, I think it just made it a lot easier for me in that sense, and when I was going out on my own, um, I didn't wanna have too much of a lapse in my income. So
Uh-huh.
I knew insurance was, like, kind of like a safe bet when it came to filling my caseload. So
Yeah, yeah, and
so
that's the
yeah.
pro. That's some of the one of the pros, what
Mhm.
for insurance, built-in referrals, so
Yeah,
less marketing
yeah.
needed, can fill your
Mhm,
caseload,
mhm.
faster, could feel like kind of like a safer start when you're like transitioning
Yeah.
into doing private practice. Do you feel like you get a good amount of like how does the referrals work through insurance? Are they through Alma? Are people
Yeah,
finding you other
so
ways?
yeah, so for insurance, I'm with only 2 insurance companies, and they're both through Alma, the insurance, that I'm credentialed with, and they, have, like, a referral tab, essentially. You just, like, click on, like, "Hey, I'm accepting consultations right now or new clients," and then Alma sends them to me through, like, their referral service, and I believe like, they work with insurance to, like, help connect
Mm,
patients to
mhm,
therapists, and so I get, like, a little alert saying, like, "Hey, somebody's interested in working with you," and they, like and then I can follow up on that, and it works really well, like, I just got back from maternity leave, and I had probably within a month, like, 10 to 12 referrals in there in the
mm,
Alma portal, and then I probably got, like 6 from other sources like Psychology Today, other therapists, and, since I do OCD work, I got a couple from Rogers Behavioral Health Hospital that I partner with as well. So, like, try to, like, diversify where the referrals are coming in from, but Alma's a good source of it, for me at least. It's worked
mhm.
out. Yeah, I
Yeah,
know some therapists have told me they have gotten very little referrals
yeah.
from Alma, and I wonder if that's because of the insurance they're paneled with, because I'm paneled with Aetna and United, and a lot of people have United, and so I think that's why I get contacted quite a bit for therapy.
Interesting.
Yeah.
Yeah, and I wonder, do you remember that, like, Alma did they advertise to you, like, "We'll give you referrals," or "We will help
Mm,
you with referrals"? Because I think I saw there's some of these companies that help you with kind of, like, the credentialing and maybe you use their EHR, and
mhm,
people complain that, like, they don't get referrals through them. But
mhm,
it's like, is that the purpose of that service, to get you referrals? Or is the purpose of the service to get
mhm.
you credentialed with the insurance and kind of like manage the paperwork and the communication with the insurance and the EHR, electronic health record system for
Okay.
charting? Do you know what I
Right.
mean?
Yeah. For me, you know, I don't know what Alma's selling points are. Like, I'm not sure if they're
Uh-huh.
like, "This is our main thing." It seems to me that the main thing that they're really working hard on is, like, credentialing therapists with insurance, um, and helping them with, like, the whole billing process, submitting claims, getting quicker pay.
Yeah.
Their EHR is not really robust yet. I use Simple Practice as my EHR, and I use Alma as my biller. They do all the credit card transactions happen through Alma, for copays. So
Yeah, I'm on their
but
site right now. It says like, simple 45-day credentialing process,
Mhm.
automated client eligibility checks. That's kind of nice. Multi-state
Oh,
credentialing.
yeah, that's right. They do credibility checks every month for your clients because the amount of times insurance expires or something changes and they're no longer eligible.
Totally. That's
So that
oof.
I liked too, that they do that, you know?
Negotiating reimbursement rates for you. I guess they have continuing
Mhm.
education.
They do.
But yeah, I mean, like, I don't see anywhere on here where they're talking about like them
Referrals.
helping you like with clients and
Mm-mm.
getting referrals.
Mhm.
Um,
Right.
yeah, but you're still probably you're listed on I mean, you're listed through Alma, but then I'm sure if I had, United Healthcare, I could go on to see what
Mhm.
therapist takes my insurance and you would be listed on like the insurance
They're
provider portal. also,
Correct.
right?
Yeah.
Yeah.
Yeah. Right.
Okay.
Yeah. I'd be listed on there. I'd be listed on Psychology Today, on my website. I have other therapists that I've worked with.
Yeah.
I really do get out there and network with people in my area about like what I do and what I provide. I'm a part of like a, uh, a therapy collective, which is where we all share an office space together. So like I am connected with people too. So like if you're wanting, yeah, if you're, that's a whole nother topic, private practice building.
Private practice building and like private
Yeah.
practice marketing. Yeah,
Yeah.
I think we can touch on it a little bit, just the fact that like I think sometimes people think like, okay, I'm getting insurance, I'm just gonna like get
Yeah.
all these referrals through
Hmm.
Psychology Today and just the insurance portal, and maybe that can work, but there's also like some other kind of marketing and networking that you will need to
Yeah.
do. Like maybe you're going to
Yeah.
doctors' offices, maybe you're going to talk to lawyers. Maybe you're
Mm,
talking to financial planners in your area because
mm.
someone who's in the financial planning space, some
Yes.
people might need therapy, like,
Yeah. Yeah.
yeah.
Yeah. You have to do that work too. You do. Yeah. I think that that's realistic as well. It's like putting
Hmm.
yourself out there, making those connections, reaching out to people. And that's why, yeah, I don't want to get on a tangent, but I do feel like that's why it's so important to stay connected with other therapists and other groups, especially if you're going to be an online therapist. Like, you really need to put yourself out there to be successful, I think,
Hmm.
and not be afraid to reach out and make connections and go out for coffee with people because also therapists, they really want to do best for their client, and they're not just going to refer to you if they haven't. Some people won't refer unless they've met you. So like
Interesting.
they want to know, like, who am I referring to? Are you just like, yeah. So especially if they're going to say this is somebody I trust and I think they're going to do really good work. So I get a lot of my referrals from other therapists. I get a lot of my referrals from OMA, and I get a few from Psychology Today. It's not great. It's not a great referral source. I get probably, yeah, that's probably the least amount that I get from is Psychology Today. So yeah, making a Psychology Today profile is not gonna cut it, I don't think. Maybe I'm wrong. Maybe there's other people who are like, I get all my referrals from there. I don't know. For me, it's been not. I mean, like a couple a month, maybe.
Hmm.
Yeah.
Hmm.
So yeah, there's a lot of pros to insurance. There's some cons to insurance. There's pros to private pay. Um, there's cons to private pay, but
Hmm.
yeah, I don't know what I'm saying and all that, but I don't really
It's
have a
just,
summary.
I think
That's what it is.
ultimately, it's like there isn't a right way to do it,
No.
and I think that's what we were talking about earlier is some people thinking
Mhm.
like, well, if you're a social worker, you better take insurance or else
Right.
you're whatever. Um, and it's just kind of like what works for you, like
Mhm.
what's your financial
Mhm.
reality right now? How
Mhm.
confident are you talking about your fees? Because if we're uncomfortable
Mhm.
talking about money, but then you're going to be charging,
Yes.
or we're taking private pay, like we need to unpack that a little bit,
Mhm. Mhm. Mhm.
What kind of marketing do you want to
Mhm.
do? I think all those things.
Right. And
If
also, like, yeah, go ahead,
go
Taylor.
no, go ahead. I was gonna ask you a question. Go. Yeah.
Oh, yeah, I was gonna say, and also, like, if you're not willing to increase your fees, like, we are collectively keeping the profession stagnant or underpaid. So, like, we
Mm,
need to all be kind of saying every year we need to be raising our fees, at least with inflation. And I think um, what we're doing is really difficult work, and
yes.
it involves a lot of risk and liability. And I mean, the amount of times you might encounter suicidality or um, abuse or neglect or any of those types of topics, given a week could be multiple times in a given week. That's a lot of liability we're holding for families. Being asked to go to court, being asked to, I mean, I've been asked to get into pulled into like court for PTSD issues, divorce issues, especially when you're working with younger clients. It's like that's a lot of liability and you deserve to be compensated for that. Not only the liability, but then that's a lot of emotional work you're doing and labor you're doing. And so that is worth something.
Mhm.
And sometimes I would say it's worth more than, well, I don't want to get cut. I don't want to get into comparing professions, so
Okay.
cut. But
Okay.
but yeah. Mhm.
What do you have any advice for younger you or maybe social workers who are considering starting private practice? What would you
Oh, in
say?
terms of like insurance or private pay,
Mhm.
or just in general, you think?
Maybe
In general?
both. I like
Yeah,
both.
both.
Yeah, let's hear both.
Um, I would say if you are a younger therapist, or what I would have said to my younger self is there's nothing wrong with starting a private practice early in your career. Go for it.
Mm,
There's a lot of stigma about that, right? Like, I haven't been doing this for 10 years, so like I shouldn't start a private
totally.
practice.
Yeah.
Just don't worry about it. Go for it.
Yeah.
Nobody actually cares. And if they do, in one ear, out the other, and keep doing your thing. Like,
Yeah, get
just, it's
support while you can.
okay.
Get
Get
some,
support,
yeah,
know
yeah,
your scope of
yeah,
practice. Don't
of
be afraid to
course.
refer out and get all the things. But there's no reason why a new clinician who just, started out shouldn't be allowed to make a good salary by doing a private practice. Like,
Hmm.
I think that is totally fine, and if that's what you want to do, go for it. Like, I think I'm all for it. So that would be my little piece of advice, and I would probably say, obviously my situation was a little different, but if I was in the United States, I would probably say starting with insurance is a good first step just to get you comfortable
Yeah.
with like how this all works. And I think it does make you really good at your notes. I think you are like,
That's
you do end up getting like really good at it. And then when you go private, you're like, oh, this is going to take me like 2 minutes. Like,
yeah.
yes.
Yeah.
But no, like, I think, um, yeah, just like taking insurance is a great way to just like get started. Um, yeah.
I love
So
that.
yeah. And
Yeah.
then I think, but if you want to go just straight private too, I think that's fine too. It just might take some time to build up your caseload.
Do your
Mhm.
thing. Do
Do
what
your
works
thing.
best for you. Wow, what a
Yeah. Yeah.
concept.
What a concept. And don't believe people that are like, you have to be really in the field for a long time to do a private practice. No, you don't.
Yeah.
We need you. We
We need
need we
therapists.
need
We need all of
therapists.
them. Yeah, especially
Yeah.
these days.
Yeah. Yeah.
Anyways,
Mm.
money moment. Let's get into the money
Money
moment. All right,
moment.
great chat
Yeah.
about private
Let's do
pay
it.
versus insurance. Money moment. My money moment
Mhm.
is yesterday I updated our net worth. A very simple net worth calculator or
Mm.
net worth Google sheet. And for anyone who doesn't know, your net worth is your assets minus your debts minus
Mm.
assets, and of whatever the balance is there. So I'm gonna say we're still in the negative. I'm not gonna lie.
That's okay.
We're still in the
We're here
negative.
for it.
We're still in the
Yeah.
negative.
What
However,
do you got though? What do you got?
I am just super impressed and excited about like the progress that we've made in the last
Yeah.
3 years. So May 2022, this is when we
Mhm.
started our financial, journey, paying off debt, whatever. Our net worth was a negative $143,000. Yeah.
Oof.
We had $277,000 of debt. That was the number. And now our net worth is negative 12,000.
What?
Mhm. Negative
Wait a minute.
12. Negative 12,000.
Taylor?
And we started with negative 143,000. It's
Dude,
amazing. We've paid off a ton
that's
of debt.
whoa.
My investments have grown so much. I think I started, yeah, May 2022, I had $10,000. Now we have 90,000 investments,
What?
large cash
Okay.
savings. We still have student loans,
Yay.
but yes, we are on the up and up. So
I mean,
feeling
I think
good.
that negative is going to turn to a positive very soon.
Oh, yeah.
12,000? You got this.
Oh, yeah,
Oh,
for sure.
yeah. You're going to be like,
Mhm.
tomorrow, I'm good. No. You're like, actually, I'm about to make a big payment. No.
I'm super excited
Are
to
you
see
guys going
that
to
go to 0
celebrate? Are you going to celebrate in some way
when
when
it
you
goes
guys hit that?
positive.
Mm-hmm. You should.
Honestly, like, some people, like, for the
Celebrate so you
assets.
go back into the negative. No. We're taking a trip. Oh, whoops.
Some people count their cars as assets, and,
Okay.
like, we
Mm.
don't. I'm not counting those, but we both have paid off cars, so, like, both of our cars together is worth more than 12,000. So it's like, I don't know. To some people, maybe we are in the positive, but I'm
Mm.
talking about assets of cash, investments, and home equity or houses, which we sold our house, so we don't have a house. So really, it's just cash and investments. And we don't have any other, like, things that we
This is so exciting.
have in terms of, like, things that we are. And I don't know. People invest in, like,
Yeah.
gold, or I guess we have like we have like 3 Pokemon cards left that we haven't sold.
Oh, because you guys sold a lot of them.
We sold a lot of them, so I think
Which
those are
is-
worth
That was
maybe
your gold. That was
$2,000.
your gold.
Okay. So, anyways, we are
You
on
didn't
the
answer
up and
my
up.
question. Are
Wait,
you
sorry. What
going
was
to
your question?
Are you going to
Oh,
celebrate?
maybe.
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 Why wouldn't you?
I guess. I don't know. I hadn't thought.
Everybody, you should
I hadn't
submit.
thought of it.
You should submit ideas of how Taylor should celebrate this. This is a big deal.
When we get to
This is a
0,
big deal.
yeah. I feel like
You
we
should
could maybe
celebrate.
get there. Maybe a couple months. We'll see. But yeah, that's
That's
the
good.
update.
Yay.
What do you got?
Definitely not as cool as that, but why did I go last? Why didn't I go first? No. You're screwing me over super hard here. No, my money moment, it is in theme with the private practice topic that we're talking about, and like insurance and private pay. So Taylor knows that I've gone back and forth on raising my private pay rate. I get like really anxious about it. Like the amount of voice memos I've sent Taylor about, I think I should do this and I should do that. No, I'm going to go back to here. It's like outrageous. But this is like what you should not do. My money moment is about like, don't do what Faith is doing. I have not raised my private rate in 4 years. Eek! Like when I was when I was abroad, it was I raised it every year when I was abroad. I started at like 120, then I went to 130, then I went to 140, then I went to 150, and I've stopped at 150 like for 3 years now. And coming back from maternity leave, I raised it $5. I said, I'm at 155 now. And like, I just want to encourage everybody, like, it's okay to raise your private rate. Do it. Don't do what I'm doing. Just be bold and go for it. But like my money moment is don't do what I'm doing.
Don't be Faith. I know
That's
she
a
was
mistake,
like,
right?
She
We
was
talk
like,
about like
yeah.
Go ahead.
Yeah, I just was going to say, I remember you being like, okay, I'm going to charge 160. I'm going to raise it to 160. And I'm like, yeah, girl, like, power to you, trying to empower her. And then I saw her in person. I'm like, yeah, 160. She's like, actually, I did 155.
Like enough to cover my credit card fees for each transaction. Like seriously, now I get like 150 instead of 145 because I added $5. So it's really not that much. But yeah,
Raise
money
your fees,
moments are
it's
supposed to
okay.
be about, it's okay to raise your fees. And money moments are supposed to be about learning and advice. And this is like a learning moment of like,
yes,
I need to just raise my fees and be confident about it. And there's nothing wrong with my fees going up.
yeah. And I'm doing an investing presentation webinar later today. And one of the slides,
Yes.
well, like 3 of the slides is about inflation and how we expect, the feds, they expect the cost of things to go up 2 to 3% every year. Like that's just baseline. We expect it, So if you don't raise your rates, then the amount that you're getting every year, you're just able to buy less with that. Yeah. So
yeah, and if you have a private practice, your rent is going to go up. The cost of these EHR or these other
the
services
things
are
that
going to go up.
you're paying for is going up, but your rate's not going up, and so it's okay.
So
It's okay.
it's okay. On that note,
On that note, everyone, thanks for listening, and we'll be back in 2 weeks.